Welcome to Neuroscience Updates, presented by Naidi Bahradian. I'm an electrical engineer who has passion for neuroscience. Within this video, you are going to hear about the latest updates of neuroscience. Could some people with schizophrenia in poor nations simply have vitamin deficiency? In your opinion, which vitamin could be responsible for causing schizophrenia or having some link with schizophrenia? Do you think a vitamin could play a major role in schizophrenia? Let's see what the researchers of the University of Toronto found. Four unresolved mysteries around schizophrenia have long plagued the medical community, but a new hypothesis identifying a common link between them and an almost forgotten epidemic of a disease called pellagra could have profound implications of our understanding of psychosis in poor nations. The new hypotheses have implications for how a subgroup of people with active psychosis could be potentially screened, treated, and cured. The idea behind the hypothesis occurred to Asma Fuller Thompson, who is a professor in the University of Toronto, after learning about recent research conducted in South India. This study newly identified a link between schizophrenia and a variant of a gene known as NAPRT1, which lowers the body's ability to use niacin or vitamin B3, which naturally occurs in meat, poultry, and egg. The researchers speculate that there is a critical interaction between an expectant mother's prenatal niacin deficiency due to malnourishment and the NAPRT1 variant that impedes the fetus's ability to use niacin. This interaction between the gene and the prenatal environment may predispose the offspring to develop a psychotic disorder. Several studies indicate that the offspring of mothers who experience famine in their first trimester of pregnancy have double the chance of developing schizophrenia. Most researchers assume nutrient deficiency may be playing a role, but the particular nutrient has yet to be identified. Fuller Thompson now speculates that the niacin may be the key nutrient involved. The identification of NAPRT1 risk variant also provides some insight into a second medical mystery. Normally, when people are given high doses of niacin, their skin reddens and can tingle, burn, or itch. However, many individuals with schizophrenia experience limited or no flushing to the same high dose amount. The presence of a gene inhibiting the uptake of niacin may explain why people with schizophrenia do not show the same reddening of the skin in response to high doses. They simply have a lower ability to absorb the vitamin. Pellagra could be an important part of the puzzle as well. Between 1906 and 1940, almost 3 million Americans developed pellagra due to niacin deficit diet. The symptoms include dermatitis, dementia, and death. In 4 to 10% of cases, active psychosis develops, which mimics schizophrenia. Pellagra became the leading cause of death in psychiatric hospitals in southern United States in that era. Treatment with niacin quickly and permanently cures the disease, including the psychosis and the dermatitis. By 1941, flour was fortified with niacin in the United States, and the disease was soon after largely eradicated. Today, diagnosis of pellagra is rare, but Fuller, Thompson, and Mehta wonder if it might be going undetected in the developing world. In most cases of pellagra, a bad rash is the first symptom, and this is usually how the disorder is diagnosed. The researchers hypothesized that individuals with psychosis and risky gene variant may not present with dermatitis. This would result in the patients being misqualified as having schizophrenia instead of easily treatable psychosis associated with niacin deficiency. Researchers' hypotheses also provide new insight into the most perplexing of medical mysteries associated with schizophrenia. Studies by the World Health Organization show that patients with schizophrenia in the developing countries recover at a markedly higher rate than those in Western nations, despite the fact that those in the Western receive more extensive medical interventions. If some of the schizophrenic uh, patients in the developing world were in fact undiagnosed pellagra cases, their psychosis may have been cured inadvertently by simply spending time in hospital where nutritious, niacin-rich food such as meat and eggs are provided. The final medical mystery has been generating debate for about half a century. Six randomized controlled trials conducted in Canada in 1950s found excellent results treating patients with schizophrenia with high doses of niacin, but multiple efforts to replicate the study in the 1970s found the intervention ineffective. The 1950s Canadian studies were conducted among patients born in the Great Depression before niacin fortification flour was adopted. It is highly probable that those with schizophrenia in Canada had malnourished niacin deficit mothers. If the patient's psychosis was due to the undiagnosed pellagra, of course the niacin treatment would be effective. The pregnant mothers of the participant in the later study benefited from universal niacin fortification and therefore the patients were unlikely to have pellagra. The researchers emphasize that both a correct diagnosis and medical supervision of niacin treatment of pellagra are essential. Taking high-dose niacin can cause life-threatening problems if not properly monitored. We acknowledge that this hypothesis is highly speculative, but feel further exploration of these ideas are warranted. In cases where the psychosis is due to pellagra, these patients could be inexpensively, quickly, and permanently cured with high dose niacin, allowing them to live a healthy, normal life. And this is something to be hopeful about. Thank you for watching the video. If you like the video, don't forget to like and follow my page so that you can get other updates in the future. Thank you.